It's a good thing babies are so cute. It lets them get away with otherwise gross behavior. They can drool all over your new shirt or sneeze in your face, and as long as it's followed up by a little coo, why, it's the most adorable thing ever. We even encourage some gross behavior, like burping. If I burped, no one would think it's very cute. We burp babies for a very good reason. It helps alleviate crankiness, gassiness, and spitting up.
In a bottle, there's a lot of air in the bottle that gets into the baby's stomach, and they get very uncomfortable from the air, and they feel little gas bubbles in their belly. So usually what we say is burp the baby once in the middle of the feed and once at the end of the feed. If the baby is very gassy, you might have to do it more frequently. You might have to do it 2 or 3 times during a feed.
If your baby seems a little fussy during his feeding, that can be an indication that his stomach is a little gassy, and it's a good time to try one of those mid-feeding burps. Other good times to burp are as you switch breasts if you breastfeed, or for every 2 to 3 ounces if you bottle feed. And of course, burp when feeding time is over.
I oftentimes will see parents taking the baby, putting her on the shoulder, and doing one of these, just like a rub like that. That doesn't do anything. You gotta really give some nice jostling and some nice vibrations to start getting it going. Believe me, it won't hurt them to get a little bit of vibrations going to get the burp up.
When burping a baby, be sure to have a cloth draped over your shoulder because it's inevitable that some of your baby's meal is going to come right back out. Babies almost always spit up a bit after eating, and the reason for that is a little anatomical mechanism called the lower esophageal sphincter, which is the valve that connects the esophagus to the stomach.
The anatomy of a baby is such that that valve is loose as compared to an adult. And when the stomach is filled, like a balloon filled with water, the contents want to go up. And because those contents are going up into a loose valve, some of the contents of the stomach, the milk, splashes back into the esophagus and then out of the baby's mouth.
This reflux of stomach contents is not always a sign of gastroesophageal reflux disease or GERD, but it can be. You don't need to worry about the frequency of spit up, but take note of its consistency.
If the contents of the stomach is a little acidy and starts to irritate the esophagus after recurrently splashing into the esophagus, then the babies get uncomfortable and the esophagus gets red and irritated. And that's what we call GERD, a gastroesophageal reflux disease. And that we will often treat with some medication, the same medication that we treat with adults. Antacid medications, H blockers, and proton pump inhibitors.
By 4 to 6 months, many babies are very efficient eaters who don't swallow as much air when they're feeding, which lessens the need for burping. Some babies never need to burp a lot in the first place. Just follow the cues your baby gives you, and you'll be fine. I'm Dr. Mike Rosen, and you're watching the eHealth Network. Stay healthy.